Welcome to our demonstration of the SphygmoCor XCEL, a cutting-edge solution for arterial health assessment, relied upon by world-class institutions like Mayo Clinic and Cleveland Clinic to advance cardiovascular care. We'll guide you through the process of using the XCEL, highlighting its simplicity and effectiveness in providing valuable insights into cardiovascular well-being. To begin, position the cuff as you would with a standard blood pressure monitor. Like a regular blood pressure measurement, we'll want to follow some general guidelines to ensure accurate results. First, keeping in mind that event conditions, walking around, a few cups of coffee, might slightly influence the results. We recommend resting for 5 minutes before assessment and avoiding caffeine or vigorous activity for at least 2 hours prior. Next, make sure the patient's feet are flat on the ground. Finally, stay still and avoid talking during the test. To begin the assessment, launch the SphygmoCor software. Next, create a new patient record by inputting their patient ID, name, gender, and date of birth. The system allows configuration, such as averaging multiple readings for accuracy, ensuring a reliable setup for the test. Next, we will take a measurement. Normally, it would take a minute or two, but here we've shortened the process for demonstration purposes. The cuff will begin to inflate and capture brachial blood pressure first. Once the brachial measurement is taken, there will be a brief 5-second countdown, and the cuff will reinflate to capture arterial health parameters. The captured waveforms are processed to create an aortic waveform visible on the screen. That is accomplished through our patented algorithm. In the results screen, you can see brachial waveforms collected at the arm, aortic waveforms generated through our algorithm. We have built-in quality control checks to ensure the results are accurate, making it easy to identify if a reading is valid. We'll go back to the Clinical tab and look at the results for this demonstration patient. Let's start with brachial blood pressure. This is the standard measurement currently used to assess hypertension. Unlike traditional blood pressure cuffs that measure only brachial blood pressure, the XCEL system provides additional insights into arterial health. Let's look at a few of these aortic parameters. Central systolic pressure, a more accurate indicator of the pressure experienced by vital organs such as the heart, brain, and kidneys. Pulse pressure reflects the variation in pressure with each heartbeat. Elevated levels can significantly increase cardiovascular risk. Augmentation pressure and augmentation index. These metrics highlight the added burden on the heart caused by arterial stiffness. You'll notice that these advanced parameters include threshold ranges, which reflect the normal progression of vascular aging derived from extensive population studies. These ranges are benchmarked against age and gender, helping to identify deviations that may signal increased cardiovascular risk. Elevated measurements can indicate heightened risk and warrant closer attention. Now, let's go back to the Detailed View tab and highlight a few other advanced measurements the XCEL captures. An advanced measurement is the subendocardial viability ratio, also known as Buchberg index. This metric, often abbreviated as SEVR, evaluates the balance between the blood supply to the heart muscle and the heart's demand, offering insights into cardiac efficiency. Another is pulse pressure amplification. It compares the difference between central and brachial pulse pressures to provide valuable information about arterial elasticity and arterial health. This quick 2-minute test is supported by reimbursement codes, making it practical for clinical use. CPT 93050 is a reimbursement code for arterial waveform analysis used to evaluate central blood pressure and other key vascular health metrics. By using this code, healthcare providers can integrate advanced diagnostic tools into patient care while ensuring reimbursement for these services. To streamline the reimbursement process, follow these steps to save the clinical report onto the computer. First, make sure that the software has been configured to print to PDF. Next, click on Print to save the report to the computer. You can now attach the report to the billing claim under CPT 93050 and include any additional required documentation for your payer. Thank you for taking the time to explore this demonstration. Using the SphygmoCor XCEL is as simple as taking a routine blood pressure measurement. Besides brachial systolic and diastolic pressures, the XCEL provides far more advanced insights into arterial health. In just 2 minutes, it captures key metrics like central blood pressure and augmentation index, making it both practical and efficient. With support for reimbursement, this technology empowers clinicians to enhance patient care while integrating seamlessly into clinical workflows. If you have any additional questions or would like to learn more, simply visit cardiax.com.